to start with labor doula care, and I just wanted to throw out, a couple of statistics. With a labor doula, you have a 25%, greater chance of a shorter labor, which I think when we think about, going into labor, that is appealing to everyone. 60% less instances of epidurals with a labor doula, 50% reduction in cesarean births. So I think that is incredible in itself, because we know that the rates in some practices and some hospitals are sky high, and any chance we can have of, having a less chance of that, we would want. And a 40% reduction in the use of Pitocin. So I think that's really important too. And just, for everyone who may not know exactly what labor doulas are, we work with pregnant families. We work with in surrogacy situations, we work in all sorts of situations, and postpartum too, we do, new parents. It could be adoption, it could be surrogacy. It really ranges from any new parenting situation. We work with those clients. But for labor doula care, we really do like to meet our clients early in pregnancy, so we can get to know them, get a really deep connection. We do work with the entire family. It's not just the birthing person. It could be a partner. It could be, whoever is going to be the support person, other kids. So we really want to get the whole family involved. And one of the main things that we do is educate about options. So I think when you meet a family, we see sort of what classes they've taken and how much they know. And, we sort of fill in the education piece there. But, I think everyone who already spoke today talked about, you don't know what you don't know. And, it's dangerous when you go into a situation and you don't know what your options are. So you wouldn't even know to educate yourself or do the research on those options. I think Shay said it earlier that, you do research about the things that you know, but there could be so many other things out there that could be relevant to your situation and appealing to you that you may not even know to take a look at. So we definitely do lots of education around options. And really want to make sure that we are getting to know our clients, getting to know, everything they would like about what they would like to see. We call it, instead of, a birth plan, a birth wish list. If everything could go absolutely perfect, what would that look like? And then what, the plan B would look like, what the plan C would look like, what the plan D would look like. And we want to make sure that they are educated and empowered to take on anything that comes their way. And there's different, scenarios, if it is an obstetrician, if it's a midwifery practice, if it's a home birth. And, we definitely work with clients who birth at home. I had my first daughter in the hospital, and, I was young and thought to myself, like, I really don't need childbirth ed, she'll come out one way or the other. And it was your classic, induction at 42 weeks. And literally went exactly how it says in the textbook. And, it was wonderful and it was beautiful. But, I learned later that I really didn't know anything about my options. And everything they offered me, I said, sure, okay. And like I said, it ended, fine. And it was the best day of my life. It was, the birth of my first daughter. But I really thought to myself, how could I help other people not go through that situation where they just don't know what their options are. And I didn't even know I could, like someone said earlier, request a nurse if we didn't, get along, or switch practices late in the game. So there's so many options out there, and there's so many things that we can choose to do or choose not to do. And just knowing that, I feel like going into birth makes you feel more confident and more empowered. And knowledge is power. Really, the more you know, the better the outcome, is going to be. And I think it's important to mention too that as a labor doula, we work with families prenatally, but we also, once, labor starts or it's getting close to that time, we can answer any questions, via text, via FaceTime, on the phone. Is this it? What's happening? Is this normal? And we're sort of your constant, little source of education and answering all your questions. We come to your house and labor with you at home. If it's time sensitive, we meet you at the hospital, but we're really with you every step of the way and staying the entire labor and delivery. And I know every, doula practice is different, but I've been at labors for 40 hours and for me, it's a really long time to be away from my family, but I made a commitment to this other birthing family that I would be with them. So I really make it a point to stay the whole time and into the postpartum room. So once the baby's born, I really, try to have the medical staff respecting sort of that golden hour and, breastfeeding within the first hour and transferring over to the postpartum room, making sure that, everyone has a meal and someone, if they need a shower, they get a shower. But really making sure that they're comfortable and, we sort of talk about a plan, what the next, 24 hours is going to look like. And if I'm doing postpartum care, then, I take it till they get home, but really making, the birthing family feel like they are comfortable, that they're confident, that they know a little bit about what's, going to be the next, day looks like, and that they can call and reach out for anything they need. But, reminding, we don't advocate for families, at least I don't advocate for families, I don't speak on their behalf, but in any situation, I will remind them to advocate for themselves. And, we know sometimes in labor and delivery, things get tough and intense, and we don't always remember what we want our, ideal outcomes to look like. So, just taking a step back and taking 2 minutes to sort of have a discussion about where, what these decisions are going to look like and what the next steps are going to be. And then letting them come back and, make a decision or give an answer or sort of, figure out what they want to do next. So really the advocate piece, for these families is a huge deal. And I actually had my second 2 kids at home, knowing myself and learning a lot about birth and just attending many births and seeing some of the things that were happening to my clients where they weren't, told ahead of time, different procedures were happening. And I don't have to, go into that, but it really made me think about my next experiences. And I had my second 2 kids at home because and I actually had a doula at both of them. My best friend happens to be a doula, so she was there, which was amazing. But I know me, and I can say all the things that I want, in other situations. But standing up to an obstetrician or a doctor or any medical professional in the moment, I knew may or may not happen. So I didn't want to be in that situation where I had to try to stand up for myself and explain what, my desires were. So I took it out of the equation altogether and had my next 2 kids at home. So I will say too that, when we're talking about a population of people who may not be able to afford labor doulas or postpartum doulas, and there's always options for people working on certification and people who work on a sliding scale. But I think, Anna Sophia, you mentioned that there's a population you work with who don't always know that they have options or can't always get to those options. I love when I do postpartum doula trainings, not labor, but I love when nurses get trained, take a doula training, because it allows them to still stay, clinical, but also they understand more about the mental and emotional piece, and just exactly what a birthing person needs that is not in the clinical part of it. And, just to highlight too, that doulas don't give any medical advice, we don't do any clinical procedures. We are solely there for the physical, mental, emotional assistance and care for our patients, but nothing medical or clinical. So I just want to make sure that that's, clear with, everyone who's listening. But, the postpartum doula takes, sort of the baton when the labor doula, leaves off, and we are meeting clients when they get home from the hospital. I meet a lot of clients really the day that they come home, and just get them situated. We talk about what the next 24 hours, are going to look like. I answer any questions that they have, just from things that happened in the hospital. And then, make sure everyone gets a shower, a good meal, a nap. And then my first real visit, I definitely do lots and lots and lots of listening about the birth story. And sometimes it's amazing. And sometimes there's, a lot of sort of bumps that happened and things that we need to go over more in depth. But your postpartum doula is an exceptional listener. We do lots of counseling. And I think, one of the markers for having less chance of any postpartum mood disorders is having adequate support postpartum. And, that's what your postpartum doula is there for. We do lots of education within the household. So it could be a partner, it could be a mother, it could be a sister, it could be friends. I mean, whoever is going to be there caring for the mom, we're sort of educating the whole group and, making sure that they know exactly how to support these new families. So, when I am caring for a mom, I make sure that she knows she is my top priority. So her health and wellness and happiness, her physical healing, her mental and emotional, care is my top priority. So we talked about it before, put your own oxygen mask first. So then you can help others, right? So I'm making sure that mom is, happy, healthy, my top priority, and then everything sort of trickles down from there. So, in saying that, I make sure that she only has to rest, relax, heal, bond with the baby, feed the baby, and everything else, either I can take off her plate or I can find someone who will, whether that's friends and family or another professional. Postpartum doulas are excellent resources, excellent resources. We can find you anything that you need, whether it is someone to help with the house cleaning, a dog walker, someone, who can help with anything else you need in the house. We sometimes run errands. We could find a family member who can run errands for you. We do lots of menu planning. We can do food shopping. We can do cooking. We do laundry. And that's in addition to all of the real-time education about newborn care. We don't take over care for you. We don't come in and just take care of everything and leave you to be, even though that sounds nice. We do lots of education and support. So you learn how to take care of the baby. You learn about bathing. You learn about everything. So when we're not there, it seems a lot easier because we've been doing it with you and supporting, but not taking over complete care. Postpartum doulas do daytime care. We do overnight care, which is wonderful. And, for me, even if I'm there overnight, if mom is breastfeeding or, pumping and feeding, then I can bring the baby to her. She can do all the feeding, but I do all the burping, rocking, diapering, so she can sort of roll over and go right back to sleep. I also, if we're in, a house that's big enough and I won't bother anyone, I can do some laundry, I can do some cooking for the next day. Basically anything that takes these things off their plate for the day. If I can get it done, then they have less to do. And then everyone can just rest, relax, heal, bond, all of the things that we want. And, we sort of have this as, our mantra for new families. But if you can spend 3 days in bed, I would love it to be longer than 3, but realistically, 3 days in bed, 3 days on the bed, and then 3 days around the bed. So even though that's only 9 days, easier when it's your first baby. If you have toddlers at home, it's not that easy, but easier with a postpartum doula. If you can spend time in your bed, time on your bed, time around your bed, let people take care of you, because the first glass of water you get for yourself, no one's going to get you any more water because you just did it. Never mind like throwing a load of laundry. So really relaxing, resting, healing, all of those things. So we mother the mother. We basically, become, what a mother would do for all of our clients. And it's wonderful. I mentioned before having labor and delivery nurses trained. I do postpartum doula training. I love to train nurses that work, on mom and baby or on the postpartum floor. So again, they know everything about the clinical piece, but they also understand the emotional piece, in that even, with breastfeeding, it's not just the logistics of latch and position. There's a whole emotional piece that goes with it. There is a huge time commitment and the time management piece and an organization piece. And, it's wonderful when our medical staff understands that as well. So it just makes, our job as a postpartum doula easier, because the transition from hospital to home becomes really seamless.